This week, data from the Centers for Disease Control and Prevention shows Hispanic and Latino Americans are being affected by the coronavirus at a disproportionately high rate. While some immigrant families struggle with job loss and health care costs, they are now turning to the Catholic Church for aid. Correspondent Mark Irons reports. Mark?
Tracy, one immigrant I spoke with is relying on a Catholic Charities clinic to provide care for his family. Many immigrants are in jobs deemed essential, increasing their risk of being exposed to the virus. But not working brings the risk of losing a paycheck for your family.
We have become so accustomed to focus our lives on working and working and working.
Armando Reyes is a construction worker. He returned to his job this week after being away since March. Now recovered, he and his wife, along with 2 of their 5 children, had tested positive for COVID-19. Reyes and his wife are uninsured.
We don't have access to any healthcare system.
Alfonso Aguilar, president of the Latino Partnership for Conservative Principles, says Reyes' story isn't unique among immigrant communities. The pandemic is shedding light on some of their struggles.
Many don't have access to health insurance, and some are losing access to health insurance because they're losing their jobs.
Data this week from the CDC shows while Hispanics and Latinos account for 18% of the U.S. population, they make up 33% of confirmed COVID-19 cases.
They've lost jobs at a higher rate than average Americans.
Reyes experienced the financial concerns without work, compounded by the fact that he has no health insurance. But his family has received assistance.
The Catholic Church, in my case, has been so generous.
The Reyes family was able to rely on a Catholic Charities facility offering health care in Virginia. The clinic tells me the church continues to show the love of Christ through ministries such as Catholic Charities and the Mother of Mercy Free Medical Clinic, which serves the poor and vulnerable, including immigrants and refugees. Aguilar says low-income immigrants, regardless of status, do have some limited options if they're in need.
Go to an emergency room, you will be treated. There are community clinics that provide services without asking legal status.
The survey from the CDC this week found that minority groups, including Hispanics, African, and Native Americans, make up the majority of coronavirus infections. Among the most common underlying health conditions found were cardiovascular diseases, diabetes, and chronic lung disease. Tracy?
Correspondent Mark Irons reporting for us tonight. Thank you so much, Mark.